Yes, sir.
Another question I get pretty frequently is what happens if I stop taking Suboxone cold turkey? Is that okay?
Short answer, no. Stopping your Suboxone cold turkey or just abruptly can lead to some pretty unpleasant effects. And those effects, essentially, it's withdrawal symptoms. That it leads to anxiety, depression, muscle aches, cramping. You just do not feel well. So I get it. The various things that come around the medication, the stigma, running out of medication, paying for medication right now, or not actually wanting to be locked onto a medication for life, all valid reasons. But you want to have a game plan. You want to have a plan of action to get off of medication. One of the things that is always going to be suggested is whatever's best for your journey. Meet with your provider, have an honest and open conversation about what you want the future to look like on this medication. Most of the time, it will be suggested that you discontinue the medication slowly. So, this is normally called a gradual drug reduction plan or a taper. So, we start at one dose and we slowly bring down the medication over time. Now, most of the time, the number can look anywhere between 10 and 20% decrease every week. It'll be different for everybody. Everyone's body chemistry is different, everyone's dose is different. It all depends on how you're feeling. We never want to rush this process because rushing this process sometimes can lead to increased cravings, which then puts you at a higher chance of maybe relapsing. There are patients that stay on Suboxone indefinitely. We have multiple research articles and studies that support being on Suboxone for long periods of time not only decrease your relapse chances, but they allow the patient to live their life.
I analogize that, if someone who has diabetes or high blood
Right,
pressure is on their diabetes medication or their blood pressure medication, we don't tell them to try to taper off their medications.
correct.
Sometimes this is just a good medication for this chronic illness, and some that might mean a kind of a indefinite period of taking this medication.
It's a chronic illness. We wouldn't take our father off of blood pressure medication because he wanted to take it, because we knew that there could be a disastrous outcome from that. It comes back down to what's best for your journey in the long run. So, as we discontinue the medication, make sure you're giving your provider all the symptoms that are happening. Whether it's small or big, we want to make sure that we're timing this and doing this correctly for your journey. One of my patients was successfully taken off medication from 16 milligrams down to zero in a few months. There were some days that were a little bit more rough, but she successfully made it by coming down nice and slow. We like the gradual drug reduction here at Bicycle Health. It's just a lot easier on our patients. They feel a lot more comfortable. They can continue with their normal daily activities because remember, you're still going to have to work, take care of the kids, take the dog out, and pay the bills. And the last thing that you want to do is feel miserable after having such a great success on Suboxone in the beginning. So always, always reach out to your provider, ask for guidance in this so they can appropriately take you down from the medication. Does that help?
Yeah, thanks, Micah. I would add,
Thank you.
I have some patients who have taken even longer, and it's just a
Yes,
even slower gradual dose reduction of
agreed.
Suboxone.